Hello, and welcome to this video learning series on breastfeeding position and latch. This video series will examine some basic techniques of positioning a latch, which can help prevent most breastfeeding problems. We'll also look at positioning ideas in more unique situations. This first video is titled Basic Technique. One of the most important keys to successful breastfeeding is how the baby is held and how the baby latches to the breast. When this part is not going well, it can set in motion a domino effect where even more issues can arise. For example, poor positioning can cause the mother to experience a very painful soreness in her sensitive nipple tissue. Sore nipples can lead to an infection if the skin is irritated and broken, and that can lead to further problems such as mastitis. If the baby's not positioned or latched well, the breast doesn't drain well enough, and that can lead to engorgement. And that can further lead to low milk production, since production builds only when the milk is removed. If the baby is not getting sufficient milk, that can lead to slow weight gain in the baby. Studies have found that 79% of mothers experience sore nipples. This is usually a result of poor positioning and latch. Another 58% experience nipple damage. The WIC Infant and Toddler Feeding Practices 2 study found that 43% of WIC women believe breastfeeding will be painful. It's one of the most common complaints of new moms. When assisting a mom with breastfeeding, start by making sure the mom is comfortable. Find a chair with arms that rock or recline back if you can. Office chairs work well for this. Consider her privacy too. Is there an office or room with a door that closes? You might give her a lightweight baby blanket if she doesn't have one of her own. This can be used to help cover the baby and provide extra privacy. As you help the mom get comfortable, point out any feeding behaviors the baby might already be showing. For example, the baby might root or turn the head toward the breast. When mom sees these behaviors, it can help her feel more confident in her baby's abilities. If you're explaining this to the mom over the phone, you can point out the cues she can watch for. Once mom gets comfortable, she'll want to make sure her back, neck, and her shoulder muscles are able to relax. These muscles can become very strained if she's not in a comfortable position. She can slide a pillow or a baby blanket rolled up under her arm or behind her back for some extra support if she needs it. You might suggest she have water or other fluids nearby. Once the hormone oxytocin begins flowing and her milk releases, she will become thirsty. Babies use innate reflexes to latch, but they still have to learn how to latch. Babies learn best when they're comfortable and ready. A crying baby is not ready. If baby's crying, stress hormones have gone up. It will be hard for them now to calm enough to latch. Mom can try calming the baby with skin-to-skin contact or by rocking or swaying the baby. A sleepy baby is also not ready. If the baby is sleepy, mom can hold the baby skin to skin. She could change the diaper or talk to the baby. She can also hand express a few drops of milk under baby's nose or on the lips. If baby does not seem comfortable, mom can try another position that the baby might like better. Now let's look at how babies latch. Did you know that babies are born with special sensory nerve cells in their mouths? When the baby is latched properly, certain neural signals are activated in their central nervous system. We call this imprinting. When the baby imprints properly at the breast, it reinforces an effective latch. Baby can learn from that to continue latching well. This is why babies need lots of opportunities to practice feeding in those early days. When you're teaching a mom how to breastfeed, it's best to use a doll and a breast model to demonstrate. When the mom can see how it works, it can build her confidence. Remember, it is not within the scope of practice for a peer counselor to touch or handle the mother's breasts. Many moms have very strong feelings about someone touching their breasts. Besides, we want to empower her so that when she's not with us, she can latch her baby by herself. After you teach the mother basic latch skills, if she's still not able to latch her baby, yield her to your WIC-designated breastfeeding expert or DBE. A good latch begins by understanding where the baby should latch. Think of the breast as a circle. A baby can latch from any direction on that circle just by following certain latch principles. First of all, the baby should be positioned so the baby is facing the breast. The baby should not have to turn the head to reach the breast. Try this little trick. Turn your head to one side all the way. Now swallow if you can. It's not easy. And it's not easy for the baby to swallow and breathe either when their head is turned to the side like that. The baby should lead into the breast with the chin. Notice how the baby in this photo is not centered over the nipple, but is actually angled below the breast. The chin is touching the breast. And this position helps the baby now to open his airway. Let's watch this short video animation that shows what that process looks like. Here's a tip to try. Move your chin down to touch your chest if you can. Now try to open your mouth. It isn't easy. Why? Well, because when we open our mouths, the top part of our jaw does not move much. It's the bottom part of our jaw that opens. Prove it to yourself by taking a glass of water and taking a drink. We raise our chin so we can open our airway when we drink. Babies need to do the same thing. So when baby opens his mouth to feed, he needs to be able to open his airway and increase the space under his chin by tilting his head back slightly. Here's another way to think about it. Whenever we eat a large sandwich or a bagel, we do not center it evenly in front of our mouth. If we did that, we'd mostly get a nose full of bread. Instead, when we eat a large sandwich, we tend to angle the sandwich a little and then we tilt our head backward. That way we can open up the space under our chin so our bottom jaw can open wide. And then we wrap our mouth over the sandwich. That helps us get a lot more sandwich in our mouth. Now let's imagine that our round breast model is a clock face. Imagine where 12 o'clock is, 6 o'clock, 3 o'clock, and 9 o'clock. If the baby is positioned in the crook of mom's arm, baby's head may be closer to the 3 o'clock position. To get any milk from this angle, the baby would have to lower the chin in order to get the breast in his mouth. This will be uncomfortable and he will latch poorly, which will cause the mom pain. Instead, mom can shift her baby a little bit more toward a 9 o'clock position. Now the baby can lead with the chin and the space under the baby's chin has opened up, so baby can now open his mouth widely. Let's watch that animated video clip once again so you can see again the alignment of the baby's chin and the mouth against the mother's breast. Notice also the angle of being below the mother's breast. This is the key to a comfortable latch. In addition to the position of the baby in relation to the mother's breast, there are other important steps to a good latch. One step is to support the breast. This is especially helpful if mom has larger breasts or if the baby's having trouble latching. You can see in this photo that the mother is supporting her breast using the common C hold. Her fingers are placed around the breast to form a C shape. Her thumb is on top and her fingers are underneath the breast. Notice that her hands or fingers are not covering the nipple or areola. Some mothers like to shift their hands a little to form a U instead of a C. When baby leads with the chin, the nose is aligned with the nipple. This is called the sniffing position or nose to nipple. Notice how the baby in this photo is not centered over the nipple. Instead, the baby is angled underneath the nipple. The baby's head is tilted back, and now the jaw can easily open widely. In this nose to nipple position, the baby can now smell the strong scent of mom's milk. This causes baby to salivate and prepare to latch. With the nipple right there by baby's nose, mom can now gently rub her nipple across the baby's upper lip between the lip and the nose. This action triggers a reflex that helps the baby to open widely. A wide open mouth like you see in this photo helps the baby to take in a large mouthful of breast. With baby's mouth open wide, mom can now bring baby in close. Notice how in this photo you can see that part of the top part of the areola, or the dark part behind the nipple, is visible. The bottom part of the areola is completely in the baby's mouth. Baby's tongue is far below the areola, or the dark part behind the nipple. Baby will now elongate the nipple to go far back into the mouth, all the way to the juncture between the hard and soft palate of the roof of the mouth. Baby's tongue will now compress the nipple against the roof of the mouth in a rhythmic wave-like motion. Let's watch a short video about Latch to see what these steps look like with a newborn.
Breastfeeding can create a special bond and benefit both the mother and the baby. A good latch is the key to making things work well. It prevents pain and ensures the baby will get enough milk. Everyone at WIC can learn how to help a mother latch her baby. When it is not going well, the WIC Designated Breastfeeding Expert, or DBE, can help. Here are some steps to watch for. Remember that staff can demonstrate these techniques to the mother using a doll and breast model. If the mother needs help, always ask permission before touching her breast. First, the baby should face the breast and not have to turn his head to one side. It's hard for anyone to eat with your head turned. See how this baby is able to open his mouth wide? Baby extends the tongue and forms a narrow channel for the milk. The breast is slightly above the center of the baby's open mouth. This will help the baby's lower jaw to open more widely. When the baby is in this position, the chin is pressed into the breast. The nose is near the nipple to help baby breathe more easily. The baby will approach the breast from below it. As you can see, baby will take in more of the tissue below the areola, or the darker part of the breast. This area of the breast can easily handle the strong compression of the baby's jaw. The tongue is under the breast and extends over the alveolar ridge. The baby extends the tongue forward and draws the nipple into the center of the mouth. When latched well, the baby takes in a large mouthful of breast. The lips are flanged out like fish lips and open wide at about a 140-degree angle. The bottom lip covers most of the areola, and the top lip covers less of the areola. This is called an asymmetrical latch. It is an important way to be sure the milk ducts are compressed. The baby's jaws are well behind the nipple and compress these ducts. Baby settles into a rhythm of sucking, swallowing, and pausing to breathe. The mother's breast and the baby's cheeks move as he sucks. Swallowing sounds like puffs of air. When the baby has long pauses early in the feeding, this mom strokes the head. This helps the baby suck again and increase milk flow. Massage can also help. The baby will usually signal the end of a feeding by releasing the nipple. If the mother needs to remove the baby from the nipple, she can insert her finger gently into the corner of the baby's mouth. Some moms may need to shape the breast to help the baby latch and stay latched during the feeding. These techniques can be used when holding the baby in the clutch, cradle, or cross-cradle positions. One way to support the breast is the C hold. With this hold, the hands are well behind the area where baby needs to latch. This can help the baby stay latched. Another way to help a baby stay latched is the dancer hand position. The mother cups her breast with her thumb on one side of her baby's cheek, with the first 2 or 3 fingers on the other cheek. The baby's chin now rests in her hand. With one of her fingers, mom gently compresses her baby's cheeks. The dancer hand position is especially helpful with preterm infants who have trouble getting a good seal at the breast. When an infant has a very small mouth or is having trouble latching, making a breast sandwich can sometimes work. Hear how a lactation consultant helps a mother to do this.
So in this position, Heather, we're going to have you support the breast a little bit for us. So you want to kind of support it that your thumb's where her nose is and your fingers are underneath her chin and off of your areola there. Good. It's called a sandwich hold. This gives a little support for the breast. Just compressing it rather than doing any squeezing and just kind of shaping it to fit her mouth.
To learn more about getting a good latch, visit the WIC Breastfeeding Essentials Training Program.
When assessing the latch, there's several key things to look for. First of all of the areola below the nipple should be in the baby's mouth. Some of the top part might be visible as you see in this photo. Secondly, the baby's chin indents the breast and the cheeks touch the breast. The baby's nose should just barely touch the breast, but should not be pushed into it. The baby's mouth is open very wide, and the baby's lips are flared out like fish lips and are not tucked in. Also, with a good latch, breastfeeding should not be painful. It's normal for most moms to feel a little tender at first. She might feel a tugging sensation on her nipple, but pain is not normal. That's her body's way of telling her something is not right. If the baby's latch is painful, mom can insert her clean finger into the corner of the baby's mouth to break the suction and try again. Another way to be sure the latch is good is to listen and observe the baby for swallowing. When the baby is swallowing, the chin will drop low, and the mom might see wiggling in the baby's neck. As baby swallows, it might sound like gentle sighs. Listen to this short video clip of a baby nursing. You can hear the swallowing sighs very clearly. When the baby slows down swallowing, mom can try massaging her breasts or doing some breast compressions. This helps move the milk through the breast. Mom can continue nursing until the baby stops sucking and swallowing or even detaches from the breast. This is baby's way of saying, "I'm starting to get full." Mom can gently remove the baby. She can change the diaper or burp the baby and offer the other breast. Let's look now at some ways to hold the baby for feedings. There's really no one right position for every mom and baby in every situation. Moms will want to experiment until they find one that feels most comfortable for them. But no matter what position the mother uses, there are common principles that apply to all. When moms follow these basic principles, they can help prevent pain. They can also make sure their baby will be able to get enough milk. This photo shows some of these common principles. Notice how the baby's entire body is facing the mother's body. The baby is also held close to mom, and there are no gaps between their bodies. If the baby's hands are in the way, the baby is not close enough to mom. Baby's head faces the breast, and the head is not turned to one side. Baby's body, head, shoulders, and hips are all in a straight line, and the baby's neck is not bent. You can also see that the mother is not leaning over the baby. As we look at some common positions, use a doll and follow along if you can. This will help you remember the concepts so you can teach them to WIC moms too. The laid-back breastfeeding position is very helpful for babies to learn first. This position triggers natural feeding instincts. Also, gravity helps baby get a deeper latch. With laid-back breastfeeding, the mom lies back in a semi-reclined position, just as you see in this photo. The baby's entire body lies on top of the mother's body. Baby's face is near the breast, so baby can self-attach. Mom can support the baby's head and shoulders. Her arms can form a nest around the baby's body if she wants. In this position, the baby's natural feeding instincts are triggered, and baby will start looking for the breast and latch. This position is also great for mom because it does not strain her back or her shoulder and arm muscles. If you have a baby doll, practice placing the doll in a laid-back position. Use your arms to form a frame around the baby's body. Notice how relaxed you feel when you're leaning back and holding the baby this way. One comfortable position for moms and babies is the cradle hold. With the cradle hold, the mom sits upright with her back supported. The baby is lying across her forearm, and mom holds baby close, just as this mom is doing. Notice how the baby faces the breast chest to chest, and the baby's head is not turned to the side. The baby's ears, shoulders, and hips are in a straight line. It can sometimes help to support the mom's arm with a pillow under the arm. A footstool or a small stack of books can help raise the feet. This helps to shift the weight and reduce tension. If you have your baby doll handy, practice placing it in the cradle position. Make sure your baby faces your chest and the head is not turned to the side. Check to be sure the baby's body is in a straight line. The baby should be lying across your forearm. Make sure your baby is positioned for an asymmetrical latch so the baby can lead in with the chin. The cross cradle hold is a variation of the cradle hold. It's a great position to support the baby to stay latched. It's often used for babies with a weak suck or those who need extra head support. Again, use your doll to follow along as we explain how it works. Begin with the baby in the cradle hold position. Now, place your free hand around the baby, supporting the baby's neck and shoulders. Remove your other arm from under the baby. Now your free arm can be used to help support your breast if needed. Practice going back and forth from cradle to cross cradle to feel the difference. Let's look at the photo of the cross cradle hold again. Notice how the baby's bottom rests in the crook of the mom's arm in this picture. The baby's body is in a straight line. The ear, shoulder, and hips are all aligned. Baby's mouth is at the level of the nipple. In this photo, the mom has a pillow to support her arm. Mom's hand supports the baby's shoulders and neck, but she's not pushing on the baby's head. Pushing on a baby's head will cause the baby to push against your hand and pull away from the breast. Another position that helps the mother better support her baby is the football or clutch hold. This hold can be helpful for a mom who's had a C-section because it takes the pressure of the baby's weight away from her incision. A mom with large breasts might find this position a little easier, and it can also be used for feeding two babies at one time. To help the baby move into a football or clutch hold, mom can begin by placing the baby on the back, lying on mom's forearm at her side. Mom uses her hands to support the baby's shoulders and neck. She does not push against the baby's head. She then brings the baby up over the breast from underneath, so the baby's head is now at the level of her breast. A pillow or a rolled-up baby blanket can be placed under her arm to give her some extra support. Let's look at the photo once again. Notice how the baby is at breast level. Mom's hand supports the baby's head and neck. In this position, the baby's tucked in very close, and mom has better control to keep the baby latched well. Let's watch this video, which tells more about basic breastfeeding positions.
There are many different ways to hold the baby during breastfeeding. The mother can use the ones that are comfortable and work well for her and her baby. Most positions have similar techniques. The baby faces the breast. The baby's body is in a straight line, and the baby opens his mouth wide to latch properly. Many experts suggest that mothers try laid-back breastfeeding first. This position helps trigger baby's sucking and feeding reflexes. It is comfortable for mom, and gravity helps baby stay latched. In this position, mom lies back semi-reclined. Baby lies across her chest, heart to heart. In this position, the baby can bob her head to locate the breast and latch unassisted. Many moms like to hold their baby in a cradle position. This position can make it easier to breastfeed discreetly in public. In the cradle hold, baby should face the mother's breast. Baby's body should be in a straight line, and the head should not be bent or turned to one side. The mother supports the baby's body with her forearm. Mom places her baby in a cross-cradle position. In this position, the mother uses her other arm to support the baby's body. Her hand supports the baby's shoulders and neck. This position helps the mother hold the baby in close, supporting her baby to stay latched throughout the feeding. Some mothers use their free hand to massage or support the breast. A pillow can be used to support the baby's weight and will help make the mother comfortable. This mother massages her breast to encourage baby to continue sucking. The football or clutch hold is another good position to support the baby's latch. It is especially helpful for a mother who has had a cesarean birth, since it helps protect the mother's incision. Mom holds the baby on his side under one arm with his feet facing back. The mother's hand supports the baby's head and neck, and her forearm supports the baby's body. Pillows help raise the baby to breast level and support the mother's arm. Teaching mothers different ways to feed their baby helps them feel confident and comfortable. To learn more about positions for breastfeeding, visit the WIC Breastfeeding Essentials Training Program.
The side-lying position helps moms relax while breastfeeding. It's another good position to use after a C-section. As you can see in this photo, the position uses the same basic techniques as other positions. The baby lies on the side, facing mom's body. The baby does not have to turn the head to reach her breast. The baby's head, neck, shoulders, and hips are all in a straight line. The mother also lies on her side. You can see that her knees are slightly bent. She can place her lower arm under her head for extra support. Now she can raise or lower her breast just by rolling her body a little one way or the other. Some moms also like to put a rolled up baby blanket behind the baby's back. This helps keep the baby on the side. When teaching mothers about the side-lying position, safety is very important. The American Academy of Pediatrics does not recommend that mothers co-sleep with their infants. Remind moms that if they get sleepy while nursing in the side-lying position, they can sit more upright. When an infant has a very small mouth or mom has a very large areola, it can often be hard for a baby to latch well. You can see the small pursed lips of the baby in this image. It may be hard for this baby to open widely enough to take in a large areola and nipple. The sandwich hold is one way to help. You can use a breast model to demonstrate the sandwich hold to a mom. To create a sandwich hold, mom places her hands behind the areola with her thumb on top and her index fingers underneath. Remind the mom not to place her hands over the areola where the baby's mouth should be. Mom can now gently compress her breast by bringing her thumb and index finger closer together. This helps shape the breast so it fits into the baby's mouth more easily. This baby is latched after the mother completed the sandwich hold. Notice how the mom's hands are well behind the areola. Her thumb is on top and her index fingers are underneath. She compressed her fingers together, which created a narrower amount of breast tissue for the baby to take into the mouth. Some babies are able to latch, but they may find it hard to stay latched. They might slide down on the nipple to create what we call a shallow latch. A shallow latch can cause the mom a great deal of nipple pain. It also prevents the baby from getting milk. This can cause them to be frustrated and fussy at the breast. When this happens, the dancer hand technique can sometimes help. You can use a breast model to demonstrate the dancer hand technique. Mom cups her breast with her first 3 fingers. Baby's chin now rests in the area of her hand between her thumb and index finger. The dancer hand technique looks like this photo. Notice how the mother's fingers are cupped under the breast. She can now gently compress the baby's cheeks with her thumb and index finger. This provides extra support to the baby's chin and cheeks to help them stay latched. Let's do a little practice now. This video will show several examples of uncomfortable positioning or ineffective latch. As each image comes up, pause the video for a few seconds. Think about what you have learned about positioning and latch. Imagine what you might want to do to improve the technique in each photo. In this image, the baby's lying on the back instead of facing the mother's body. The breast tissue appears to be pinched from a poor latch, and the baby has very little of mom's areola in the mouth. So to improve this technique, you might suggest that the mother turn her baby to face her body. She can shift him so the baby's chin is touching the breast, and then angle the baby so he's leading in with the chin. In this photo, the baby's mouth is not open wide. Mom is hunched over the baby, and the baby's lying on the back instead of facing mom. To adjust this, suggest the mom gently break the latch and start a new latch. She can now roll her baby on the side to face her body. Now she can shift the baby so the head tilts back to take in the bottom part of the areola. This baby is tucked into the crook of mom's arm. The baby's body is bent instead of being in a straight line. The hips and shoulders and neck are not in a straight line. To adjust this latch, suggest that mom roll the baby onto the side to face mom's body. She can also shift the baby to a little bit more of a 3 o'clock position on this breast. Now baby can open the airway and take in a larger amount of breast tissue. In this photo, the baby's mouth is not open wide. His bottom lip is not at the bottom of the areola, and he is not nose to nipple. Mom's hands also cover part of the areola where we want the baby's mouth to go. If the mom continues this latch, it will cause pain. To improve the latch, mom can bring her hands back behind her areola. She can then shift her baby down to where the baby is nose to nipple. This will help baby take in much more of the bottom part of her areola. In this photo, the baby is not latched deeply enough and might be latched only onto mom's nipple. Notice how the baby is lying more on the side and has to turn the head in order to latch. So to adjust this, suggest the mother turn her baby to the side. Now she can slide the baby down to where the bottom part of the areola can easily be taken in. The mom can now help the baby open widely by tickling the space between the upper lip and nose. This will help trigger the wide open mouth instinct. This mother is attempting to do a sandwich hold to help her baby latch. While she's compressing her areola to create a smaller area for her baby to latch, her index finger covers the bottom part of the areola where the baby's mouth needs to be. So you want to suggest that the mom move her fingers to below the areola as she compresses it. This ends the video basic technique as part of the Position and Latch video series. Please take a few moments to pull out your Wick Action Journal and turn to the Position and Latch page. Write down something you did not know before viewing this video, or something you want to be sure and remember. Set at least one goal of something you will do with what you have learned. Please complete the Level 2 post-test for this basic technique video. Please turn it into your supervisor along with any handouts for this video series.